I'm Julie Bartke with Senate Update. Many large healthcare plans provide incentives for policyholders to exercise regularly by offering credits for gym memberships. Well, there's a proposal about to be detailed in the Senate Health, Human Services, and Housing Committee that would provide the same opportunities for small business employees.
Our bill today will allow a small business to take a corporate tax subtraction for off-site fitness facility fees for their employees. But we're really not here to talk about the tax issues. We're here to talk about the health advantages since you're the Health Committee. It's no secret that the cost of health care impacts every aspect of our economic well-being. The cost of
excuse me, Senator Pappas, would you pull your microphone up? And then for those who are in the gallery, would you make sure your conversations are in the hall?
The cost of insurance and medical care keeps rising, keeps eating away at a larger chunk of a business's budget and our own family budgets. This is only one aspect of the cost. When we're sick, we miss time at work and we're less productive when we're there. Our energy level is lower, and so too is our enthusiasm for work activities. This committee is probably very familiar with these stats that are worth reminding us all. 1 in 2 adults have been diagnosed with at least one chronic disease. 75% of all healthcare costs are spent on diagnosing and treating chronic diseases nationwide. 63.1% of Minnesota adults are overweight or obese. That's 63.1%. Nearly 50% of Minnesota obesity-related costs are paid for by Medicare and Medicaid, and obesity rates have more than doubled in Minnesota over the past 20 years. Minnesota obesity-related medical costs total $1.3 billion. Now, what are the advantages of an employee wellness program that has been proven through research? That we have positive returns for both employers and employees. Here are some examples of how workplace wellness programs show results. A company gains an average of $5.81 for every dollar invested in health management programs. These programs reduce sick leave absenteeism by an average of 26.8%. Absentee costs fall about $2.73 for every dollar spent on a workplace wellness program. They reduce healthcare costs by 26%. They reduce workers' compensation and disability management claims costs by 32%. 51% of participants in workplace wellness programs say they work harder and perform better. Some benefits for the employee include increased well-being, self-image, self-esteem, improved coping skills with stress or other factors affecting health, improve health status, you sleep better, lower costs for acute health issues, lower out-of-pocket costs for health care services, increase access to health promotion resources and social support, improve job satisfaction, a safer and more supportive work environment.
Let me just say this. I think you're all aware, certainly along these lines, many of the larger businesses have engaged this kind of activity and promoted it amongst their amongst their employee workforce. To some greater extent, I think we all realize, though, that there's a lot of folks out there, maybe, frankly, most Minnesotans that work for smaller businesses that don't have access to the opportunities and privileges maybe some of the larger employers provide, and as a result, either don't do anything or have to find it along the way in whatever form they do in terms of a fitness program, if they find one at all. And so this bill, Madam Chair and members, attempts to get at that, to really, I think, provide an opportunity, a almost systematic approach across our state for employers to engage their employees in some sort of a wellness program. If the employee wants to do that, there's certainly obligations. It's not a one-way street. If the employer does this, the employee is obligated to participate and even quantitatively participate in the program at least 8 times a month. So again, it's not a total giveaway. It is a two-way street. And I think that's important as we think about tax credits for something like this. Madam Chair, you know, a healthy state is a productive state. A productive state is a prosperous state. And as we think about a prosperous Minnesota, and we all know that we're known for our productivity, but I think we can squeeze that apple even a little bit further with a healthy workforce. And I think this takes us down that road. As I think about my own experience, there's a beginning of life and there's an end of life, and what we do in the middle of that along the way really, I think, is all of our personal decisions. And in my own case, as I thought I was a pretty good athlete in high school, and life moves on, and you get a little sloppy, you eat a little bit too much, you exercise a little bit too little, you maybe take on a little bit too much stress, and pretty soon, in my case, you're 330 pounds, you wear 56 suits, blood pressure is a little high, the blood chemistries aren't what they're supposed to be, you got a little sleep apnea, and life goes on. And you don't kind of realize it, I don't think, until you maybe have your own personal epiphany or awakening, and you start to do that. And you realize life's really, in the end, all about health and happiness. And if you ever had an opportunity to work for Mayo Clinic, as I did, you realize fully that all you need to do is walk the halls and realize health is really everything. It doesn't matter how much money you have, et cetera, et cetera. Health, in the end, is really everything, and that's what's really important in life. So as we go forth, many of us in that 63% factor already, and continue to be obese. I guess that's it. 63% of people are obese. I'm one of them. But we're working on it, and we're trying to get there. And as we think about, I think, this bill in particularly, the bill, I think, will afford employers across Minnesota the opportunity to provide for their employees the opportunity for wellness in a systematic, programmatic way, with responsibilities from the employees back to the program with respect to participation. So I fully support this. I think it's good for Minnesota. It can, I think, make our Minnesota, if you will, a state that stands tall amongst other states from the standpoint of health and wellness. And as you consider the past conversation you just had on the previous bill, and I'm sitting here thinking, you know what, a lot of these things maybe we wouldn't have to worry about at least as much if we had a more healthy society. We shouldn't be in some of these situations in the first place, but for the fact that all of us go down a journey in life that's sometimes not as healthy as it could be. This will help that, and I hope that we have good support for the bill.
Thank you, Senator Senjem. Is there anyone else that's wishing to testify on this bill, Senate File 350? Seeing none, we'll close the public input at this time and offer the opportunity for questions at this time. You know, I will say, I don't know if anybody indicated if there was a question, that this really is a bill about allowing for a membership expense income tax subtraction in fitness center fees. And you might wonder why that's here in front of our committee, but I did think that it would be of interest to the members of this committee to show support for this bill because of our commitment to good health policy. So this really is not traditionally the kind of bill that we would hear in the committee, excepting for that purpose, that the goal of the tax incentive is in keeping with what this committee is trying to drive in the state of Minnesota. So with that, did I see somebody had a question here? Senator Benson.
Madam Chair, and it's a tax bill, so we're out of my comfort zone a little bit, but perhaps a member of the tax committee who's present could clarify. If a corporation's paying for it as an employee benefit, isn't it already deductible?
Is there anybody here who would like to try to take that? Senator Pappas.
Madam Chair, I believe, and we'll get into more detail in the tax committee, that it is federally, but not at a state level, I believe. And it's not deductible, it's a subtraction from corporate. It's for the small business. And they don't have access to that. That if a large business has a fitness facility on site, then they get some benefits for that. They will have to pay, they will have to consider it income to the employee. If they provide, it's a limit of $40 a month, and that would be considered income to the employee.
Okay.
Senator Benson?
Madam Chair, because I know there are health plans available where if you visit 8 times, you get a reduction on your gym membership. And so I don't know if we're being redundant. If we're working on federal conformity, I'm fine with that. Let's just make life easier for everybody. I just having a hard time understanding where this fits in that continuum. And so as it moves forward, I will retain interest. I used to appreciate being able to be a member of the YMCA. Not a lot of time for that anymore. So I understand where this is going and how employers would want to offer this to an employee, just not sure where it fits. And again, if it's federal conformity, I'm on board. Otherwise, we're adding some complications. We'll need to take a look at it.
Madam Chair and Senator Benson will certainly straighten all that out in the tax committee. And I do know that there are health plans that do offer it, because my sister is one, and she will often say to me, well, I can't meet with you until, or have dinner with you, or go somewhere with you until after I go to Curves, because I still have to get one more exercise session in this month in order to get my benefit. So I know it's been very motivational for her.